So let's get started. Good morning to those of you on the West Coast. Good afternoon to those on the East Coast and everyone in between. Welcome to the Mental Health Commission of Canada's webinar today on men's mental health and suicide prevention in post-secondary years. Bonjour à vous, mon nom est Amy Fogarty. Je suis gestionnaire à la Commission de la santé mentale du Canada.
Hello, everyone. I'm a manager at the HCC. I'm happy to greet you all this afternoon on prevention of suicide.
I'm a manager at the Mental Health Commission of Canada, and I have the pleasure of opening today's webinar, which will be an important conversation to discuss and learn about men's mental health and well-being and how the post-secondary community can support holistic well-being for men on their campuses. To get us started, I do need to cover several housekeeping items before we begin. So we are pleased to be offering this webinar in both official languages. Today's webinar will be presented in English with simultaneous French interpretation. So to activate simultaneous interpretation, please click on the interpretation button at the bottom right of your screen and you can select your preferred language. We encourage everyone to enable interpretation to ensure that you can participate in the webinar of your choice. I will just now repeat those instructions in French for francophones who are joining us. Donc, nous avons le plaisir d'offrir la participation à ce webinaire dans les deux langues officielles. Le webinaire se déroulera en anglais aujourd'hui. Il sera soutenu
The
par
webinar will be in English today, and we'll have simultaneous interpretation in French. And in order to use this interpretation, you have a button, interpretation button at the bottom of your screen, and you can select the language of your choice. We invite you to use the interpretation to make sure you can participate to this webinar in the language of your choice.
The webinar slides are available as well in both official languages. If you'd like to follow along to the slides in French, please select View Options at the top of your screen and select the French option under the heading Shared Screens. You can also refer to the visual on the slide for guidance on where to find this setting. So you'll refer to that as Présentation FR. If you'd like to ask questions in the language of your choice at any time in this webinar, you're welcome to do so. You're able to click the Q&A button at the bottom of your screen as well. We will endeavor to have your questions answered during the question and answer period at the end of this webinar. And for ease of reference, please indicate which speaker your question is directed to, or if your question applies to all speakers. So getting us started, we at the Mental Health Commission of Canada, we work day in, day out to develop resources, influence sound public policy, act as a convener of diverse perspectives, and also seek to inspire collective action. Our main offices are located on the traditional and unceded territory of the Algonquin and Anishinaabe peoples, and that includes contemporary Ottawa, where I'm speaking to you from today. In our work, we do endeavor to infuse cultural safety and humility into our initiatives and to ensure the voices and experiences of Indigenous peoples are heard and listened to in the development and implementation of our work. As an organization, one of our many areas of focus is advancing mental health in post-secondary, and that has been for about 5 years now. And so throughout that time, we have heard from post-secondary students who already face additional challenges to their mental health and well-being, that in particular, Indigenous students have unique realities and face supplementary barriers to their well-being. So at the Commission, we are committed to continue to gaining a better understanding of those specific realities and needs in order to support post-secondary institutions in their work to provide safer and more inclusive learning environments that are supportive of the mental health and well-being of everyone. Also up front, we do want to take a moment to recognize that many of you joining us today have a personal and perhaps even a professional connection to mental health problems, to mental illness, to suicide, and the work of suicide prevention. And when we hear the tragic news of a loss of a family member, a loved one, a friend, or a colleague, perhaps to suicide, we are reminded of the importance of the work around life promotion and suicide prevention. If anyone is in need of support during or after today's webinar, we do want to ensure that you have supports available to you that can meet your needs. To make this easier, we've listed on screen some of those really helpful supports that you can access at any time if you feel the need. Please also glance at the chat where links will be shared to a number of resources and a range of useful web links that are also on display at this very moment on your screen. So please take a moment to copy those over for yourself if you do have the need. We'll be reminding you as well throughout this webinar. For those of you joining us today who don't know much about our organization, the Mental Health Commission of Canada, you may be surprised to know we were created about a decade and a half ago in 2007 by the Government of Canada at the time. One of our first pieces of work was a mental health strategy for Canada, and that was released in 2012. That strategy includes a number of priorities and recommendations that we continue to work on to this day to guide our efforts and our work. And now in 2023, we lead the development and dissemination of innovative programs and tools to support the mental health and wellness of Canadians. As an organization, we're supported by funding from Health Canada. We're also supported by partnerships with federal, provincial, and territorial governments. We're supported by foundations, private sector organizations, as well as donations from the public. We're a national not-for-profit corporation, and we're also a registered charity. And our purpose around our work is to shine a light on mental health and really work to improve the lives of people who experience mental health problems and illnesses, as well as their families and caregivers. And at the heart of our work, we believe that people should get the chance to achieve their fullest health potential. We're known in part for offering accessible training programs that support mental health in communities and workplaces, and we also lead research and program initiatives that emphasize people-centered values like living and lived experience. Some of our work revolves around suicide prevention, stigma and discrimination, access to high quality, culturally appropriate mental health services, substance use health, workplace psychological health and safety. So 10 years ago, we championed a standard, which was the first in the world at the time when it was released in 2013. And lastly, mental health and well-being in post-secondary, and that's supported by a standard released about 3 years ago that we'll be talking about today. And so today we are looking forward to sharing with you more about emerging research in men's mental health and suicide prevention in Canada, as well as the standard for mental health and well-being for post-secondary students. Findings from the Mental Health Commission of Canada's evidence brief on men's mental health and suicide prevention will be woven throughout today's webinar, and we'll also contextualize some of these findings to the post-secondary standard to help paint a picture of how research in this area can inform post-secondary institutions' work with the standard. And last but not least, we're really excited to hear from experts in this space today, including student affairs professionals and students themselves with living and lived experience of mental health and suicide prevention. Really pleased to have them join us, as well as our Senior Vice President and Chief Program Officer, to discuss the importance of men's mental health and what post-secondary institutions can do to support and encourage men's well-being on campuses. Also, a moment to recognize upfront that much of the available data collected on mental health and suicide examines differences in mental health and suicide behavior according to sex and not gender differences, and or lacks information on how sex and gender were operationalized and measured. So we acknowledge that this sex binary is a big limitation in currently available research, and it can oversimplify the complexity and diverse spectrum of gender identities that do exist. So throughout today's webinar, we'll be using the term men. And although this term does not encapsulate the different gender identities and experiences of men in Canada, it aligns with how many existing research studies on mental health and suicide have measured and analyzed sex differences. In terms of the population in men in Canada, there are multiple and diverse identities that exist beyond sex and gender. So Canada is home to over 38 people, and men make up almost half of the population, with nearly 1 in 4 of these belonging to racialized groups. For example, Asian, African, Caribbean, and Black peoples, and more than 800,000 who self-identify as Indigenous men. Data from Statistics Canada estimate that close to 4% of the population identifies as LGBTQ+, with 25% of those self-identifying as gay. We also recognize we have a long way to go to better understanding and addressing the diverse needs of different groups of men, and how geography and culture, as well as intersections of gender, race, and systems of power and oppression intersect and impact men's mental health and the risk of suicide. And now I have the pleasure of introducing the Mental Health Commission of Canada's Senior Vice President and Chief Program Officer, Ed Mantler. So a bit about Ed to give you some context. Ed is a highly motivated visionary and an expert in building partnerships, fostering engagement, and aligning strategic objectives. Ed has also led innovation and improvement in healthcare for over 2 decades. Ed is dedicated to promoting mental health in Canada and changing the attitudes of Canadians towards mental health problems and illnesses. Ed pays particular attention to reducing stigmas and increasing mental resiliency through innovative measures like mental health first aid, the National Standard for Psychological Health and Safety in the Workplace, suicide prevention, as well as the Mental Health Strategy for Canada. Ed holds a Master's of Science Administration, is a registered psychiatric nurse, and a certified health executive. So it's very much my pleasure to welcome Ed. He'll be moderating the panel a little bit later in today's session. And for now, we'll be presenting some important information about gendered experiences of mental health and suicide to set the stage. So thank you, Ed, and over to you.
Great. Thank you so much, Amy. I had no idea the introduction would be so detailed, but appreciate that. And it's my pleasure to be with you today as a moderator for this really important discussion. Welcome to all, and thank you for joining us. As we hear about the important topic of men's mental health and hear about the important work that's been done and still needs to be done for men in Canada, I really want to encourage you to reflect on how we can stand in partnership and stand together as a community to prevent men from dying by suicide. Suicide is a leading cause of death in Canada, as you know. Each year, about 4,500 people die by suicide, and that's about a dozen a day. The data on suicide tells us that the rates are not equally distributed across sex and gender. Researchers have noted a gender paradox where women are more likely to attempt suicide, but men are more likely to die by suicide. From the 4,500 deaths that occur, that dozen people each day in Canada, about 75% of them are men. Mental health and suicide are complex and multifactorial, and the risk of suicide and risk factors present vary considerably across groups and subgroups. As Amy noted previously, men are a diverse group. Our understanding of the experience and needs of different groups among men needs to be informed by the social determinants of health, such as income, education, social inclusion, and experiences of discrimination, as well as through an intersectionality lens. To better understand why men are dying by suicide at 3 times the rate of women, what might increase their risk for suicide, and how we can tailor suicide prevention practices for the unique needs of men, the suicide prevention team at the Commission conducted a thorough literature review in 2022. The findings from the review highlighted several shared factors that contribute to and increase the risk of suicide for men, and things like male-type depression, which is characterized by symptoms like substance use, risk-taking, impulsivity, and others. Not only are many of these symptoms risk factors for suicide, but they're not measured when using conventional screening diagnostic tools, which is thought to contribute to the high rates of undiagnosed and untreated depression among men. Traditional masculine forms and norms like strength, toughness, self-resilience, stoicism have been linked to increased risk of suicide, and these norms can feed into negative attitudes, beliefs, and behaviors related to mental health and related to understanding the benefits of help seeking. Poor mental health literacy and help seeking are a factor. Men have been shown to have both lower mental health literacy and to be less likely to seek out help for mental health related concerns. Not only have men been shown to be less aware of and less able to recognize the signs of mental illness in themselves and others, they're more likely to hold off on accessing mental health services until the need for support becomes very serious, and far more likely to drop out of treatment if they do initiate treatment. Substance use, depression, social isolation, and loneliness, loss of connectedness are some of the strongest risk factors for suicide amongst men. Drinking alcohol, whether acutely, heavily, or over a long period of time, can lead to or worsen depression, depressive symptoms, reduce fear and inhibition, and lead to more serious suicide attempts. Not only are men more likely to be diagnosed with alcohol use disorder, they're also more likely to have higher blood alcohol levels at the time of their death by suicide. Diagnosis of depression is one of the strongest predictors of suicide for men. This risk is even higher among men who have depression. Research shows that men are at higher risk for suicide following a relationship breakdown, and that being single, unmarried, divorced, or widowed significantly increases their risk of suicide. Men have been found to be 6 to 8 times more likely to die by suicide following separation or depression or divorce compared to women. When we think about students and how some of this evidence intersects specifically with men in post-secondary and student life and contributing to the risk factors, it's complex. Acquiring a post-secondary education can be an exciting, transformative, and demanding time. Yet, as the student demographic and student realities are constantly evolving, students are increasingly facing new and exacerbated challenges like housing, food insecurity, and other things that often intersect with and compound their mental health challenges. The intersection of age and the onset of mental health problems can't be overstated. The post-secondary years are often an age in which people are more susceptible to developing mental health issues, with 75% of people who receive a diagnosis of a mental health disorder first receiving that diagnosis between the ages of 16 and 24. In Canada, between 2018 and 2022, anxiety symptoms increased among students by 29%. Meanwhile, in 2022, 1 in 3 students reported that mental health services at post-secondary institutions did not meet their diverse needs. And emerging data from this year is revealing that students are opting to access counseling supports less frequently and are favoring other forms of support. I'm going to turn things over to Sarah to share more about the post-secondary student standard and how it can inform work on this important topic. Sarah?
Great. Thank you so much, Ed. My name is Sarah. I'm the program manager leading work with the post-secondary student standard at the MHCC, and we're really excited to have you joining us today for this important conversation. As Ed mentioned, the influences on mental health and well-being are intersectional and complex. The socio-ecological model, which is one of the guiding models that serves as a foundation for the recommendations of the standard, really underlines the intricate influences on mental health and well-being. It encompasses factors from personal choices to societal norms that affect our behaviors and health, and emphasizes the interconnectedness between individual, interpersonal, community, and institutional factors on mental health and well-being. So as we know, the intersectionality between mental health and social determinants of health, like food and housing, really underscores the profound impact that socioeconomic, institutional, and societal factors have on mental health and well-being, making it clear that ensuring access to these essentials isn't only a matter of equity, but also a step towards nurturing mental health for the entire campus community. So what is the standard? For some of you joining, this might be the first time you're hearing more about it, or for others, your institution might already be on a journey towards implementing it. The standard is a voluntary, flexible set of guidelines aimed at promoting and improving the mental health and well-being of students in post-secondary institutions across Canada. It presents an opportunity for institutions to reaffirm their commitment to promote positive student mental health and well-being, and it's grounded in a commitment to continuous improvement. It's also designed to be adaptable to the unique needs and circumstances of each institution, regardless of size or student demographic. So that means that each institution can determine their own priorities for improving student mental health and well-being over time, no matter where they start in their work with the standard. The standard also supports holistic approaches to mental health, as it encourages assessment, actions, and interventions by the institution at multiple levels in order to holistically understand and address elements that impact student well-being, recalling that socio-ecological model, which is one of the guiding models of the standard. So that means that as institutions work to address and support students' immediate needs like food, housing, harm reduction, or substance use, they're working in some way with the standard. And vice versa, working with the standard also means that an institution is addressing these interconnected realities that impact mental health and well-being. Along with the socio-ecological model as a guiding framework for the standard, there are also 6 guiding principles that the standard is based on, which include first and foremost student-centeredness, equity, diversity, and inclusion, being knowledge-informed, health promotion and harm reduction, a thriving community and culture of well-being, and continuous improvement. Altogether, these serve as a roadmap to guide institutions to align with the clauses of the standard and support decision-making and action in campus mental health, with approaches that encompass staff, faculty, and students within the post-secondary community. Now, how each institution operationalizes these guiding principles and puts them into action is up to them and the needs of their community, which is why we say that the standard is flexible. So we know from work that informed the development of the standard that help-seeking behaviors are relatively low across certain student populations, one of those being men. Students identified several barriers to help-seeking, including concerns about confidentiality, lack of time, not believing the problem warranted professional help, uncertainty that professional help would be beneficial, and preferring to rely on other sources of support like friends, family, or a romantic partner. Men also report different triggers than female students when it comes to thoughts of suicide and self-injury. For instance, men more often attribute academic competition, financial strain, and workload to thoughts of suicide, while female students more often attributed heartbreak, family pressure, and pre-existing mental illness. Work with the standard should be informed on an ongoing basis by student realities and needs, which echoes the guiding principle of being knowledge informed. It's important that an institution's mental health framework and work in campus mental health and related initiatives incorporate lived expertise, that they be evidence-based and reflect changing circumstances, emerging trends, and issues that students are facing. So we hope that today's discussion will offer practical examples of how to implement the standard with the guidance that research and lived experience in men's mental health can provide. As we know, mental health and well-being supports play a crucial role in a systemic and holistic approach to mental health on campus. Offering a comprehensive set of supports and resources addresses the multifaceted nature of well-being. It promotes early intervention and resilience and recognizes the interconnectedness of various factors at individual, community, and societal levels. The guidance of the standard supports institutions to provide access to a broad range of services, which includes those that take an upstream and preventative approach to those that are more clinical in nature, like counseling and psychiatric services. And this list, of course, isn't comprehensive. Initiatives like having a therapy dog in the library during exams or training on sleep hygiene for students are all encompassed in providing students with a broad range of access to diverse options to support their mental health and well-being, whether it's preventative or otherwise. Culturally relevant supports are also really important. In 2021, more than 2/3, or that's about 68% of campuses, reported that they had enhanced their collaboration with external mental health services in order to better support their students' needs and increase access to services. We continue to hear of ongoing initiatives like these that have supported institutions to expand their offerings and connect students to culturally sensitive, trauma-informed supports that the institution itself might not provide. Having diverse support options ensures that students can find help that best suits their needs, promotes their well-being and academic success. And ultimately, it's important that supports and services be reflective of the needs of those that the initiatives are seeking to support, and in this case, the unique needs of men in post-secondary. So on that note, I'll invite my colleague Megan to share more specifically about mental health supports for men.
Thank you, Sarah. Hello, everybody. Good afternoon and good morning to some. My name is Megan Barrett-Bernstein, and I'm a policy and research analyst working on the suicide prevention team here at the Commission. So to build on what Sarah was saying and drawing from some of the findings that Ed presented earlier from the evidence brief on mental health and suicide prevention in men, we know that mental health supports for men need to first and foremost be tailored to the diverse needs of diverse men. So they need to be identity affirming and culturally acceptable. We know that the different identities, realities, and life experiences of the populations we serve directly impact if and how they access services, as well as to what extent they benefit from the supports that they're offered and that they receive. So mental health supports and suicide prevention efforts really need to consider and be informed by the social determinants of health and an intersectionality lens. Supports also really need to consider and address unique factors that are driving mental health issues and suicide among men. So including some of those items that Ed presented earlier. So substance use, male-type depression, mental health stigma, social isolation, and adherence to masculine norms. They also need to leverage what we know works and what men have been shown to prefer. So some studies have shown that men are twice as likely to seek out resources online than to consult a mental health professional. So having access to online resources that utilize plain and safe language, that normalize help seeking, and that utilize interactive strategies to enhance mental health literacy are a really good place to start. And finally, we can't overstate the importance of not taking a one-size-fits-all approach. So supports and interventions really need to be place-based, provide culturally appropriate supports that consider capacity, socioeconomic and cultural landscape, and consider underlying inequities of the populations they serve. The next slide, yeah. So mental health literacy, early intervention, and crisis management are really critical components and key outcomes of work with the standard. They're essential for ensuring that students and staff alike are equipped to recognize mental health issues and signs of distress in themselves and in others, to intervene early, to respond in times of crisis, and to know how and where to seek out appropriate supports. So as the standard reinforces, work in student mental health is a shared and collective responsibility that includes students, faculty, staff, and stakeholders in the broader community. Efforts and initiatives to promote mental health and prevent suicide on campus should encompass equipping the entire post-secondary community with competencies that support and address barriers to mental health and wellness. So to support mental health literacy, early intervention, and crisis management, particularly in the post-secondary space and among men, really need to highlight the importance of mental health being understood by everyone. So promoting mental health awareness on campus plays a critical role in reducing stigma and empowers students to recognize early signs of distress and contributes to an overall culture of help seeking and timely intervention. So in addition to kind of general mental health awareness, there's a need for staff and students alike to know what warning signs of mental health and suicide look like. So knowing that men are less likely to identify signs of mental illness and to seek out help, increased mental health awareness from the lens of men's mental health is critical. In particular, there's a great need for increased awareness and detection of male-type depression, which we've heard can look very different from what is considered typical. So for example, risk-taking, impulsivity, anger, and substance use. So introducing and explaining these novel and complex topics to help staff, men, and their friends and families recognize signs of depression and mental health issues can really help reduce stigma, increase help seeking, and facilitate earlier intervention among men. And on the point of knowing how, when, and where to get help, communicating widely to students about the range of supports and resources available to them helps them know where to go and how to access supports when they need them most. Awareness campaigns that are tailored towards men, that focus on where and how men can get help and that are tied to broader community initiatives have been shown to be effective in promoting mental health literacy and help seeking. And information on referral practices and role clarity for staff and faculty are really essential for supporting early intervention and for ensuring that those in need are referred to appropriate resources and services. This involves awareness of referral pathways, both on and off campus, whether that means referring to wellness services, a campus health navigator, or otherwise. And lastly, knowing how to intervene in a crisis. So this can include having a crisis protocol, providing training for staff, faculty, and students alike, such as awareness of signs of a crisis, de-escalation, or intervention training, and ensuring that crisis support resources are readily available for all those in crisis. And then last, but certainly not least, really ensuring that those who are intervening have access to supports themselves. So next slide. So with that in mind, we wanted to briefly highlight a handful of gatekeeper training programs that are aimed at improving early detection of mental illness, suicidal ideation, and behavior by training community members to recognize and refer those who may be at risk. So mental health first aid and the Working Mind post-secondary are both trainings offered through the Mental Health Commission of Canada. They're designed to build mental health literacy, decrease stigmatizing attitudes, and help individuals understand, identify, and respond to signs of mental illness. So the Working Mind post-secondary is specifically designed for educational and student settings. And finally, Safe Talk and Assist, both offered by Living Works, support suicide awareness and suicide intervention training, respectively. So if you're interested in those programs, you can find some information online. A big thank you to everyone, and back over to you, Sarah.
Thank you, Megan. So it's very important for us in our work to ground it in the perspective and experiences of students. And over the years, we've had the pleasure of connecting with many students who've shared their valuable insights and perspectives with us. And we're pleased that some of those students are joining us today on the panel. And Ajane is also one of those students who we've heard from and learned a lot from as well. In this quote, Ajane shares about his excitement to move to Canada with the promise of a fresh start, but how shortly after his move, excitement gave way to anxiety, stress, and homesickness. He goes on to share, in Jamaica, I internalized the philosophy that men can't show weakness, a mindset that clashed with the openness encouraged in Canada. The struggle to accept my sexuality and confront childhood traumas intensified the internal battle. In his role as president of the Centennial College Student Association, he advocates for diverse mental health professionals on campuses, culturally educated faculty, and dynamic programs emphasizing mental well-being. His advocacy aims to rewrite narratives and foster a brighter future for students navigating the challenges of higher education. So with that in mind, we're excited to hear from our panel on this topic. But before we do, I want to remind you of the resources and supports that are available to you throughout this discussion. Again, we acknowledge that the conversation today includes discussion of mental health and sensitive topics. If you're in need of support, we've listed some resources on the screens, again, that we referred to earlier on, and we invite you to access them at any time that you feel in need, and we'll share these resources in the chat again. Now I'm pleased to welcome Ed back to introduce our panelists and to kick off our panel discussion.
Great. Thank you, Sarah, and thank you, Megan, for sharing that important information. And I'm pretty excited to turn the conversation over to our panel of experts who are very generously offering us their time today, as well as their knowledge, expertise, and perspective, so that we can all better understand how to support men's mental health in the post-secondary context. We'll be hearing today about lived experience, successful research programs, community initiatives, and what's needed to advance efforts for men's mental health on campus. So I can't wait to hear from the panel. First, we have Dr. John Olive, who's a professor and Tier 1 Canada Research Chair in Men's Mental Health Promotion at the University of British Columbia School of Nursing, founder and lead investigator of UBC's Mental Health Research Program. John's work focuses on masculinity and its influence on men's mental health behaviors and illness management, and impact on partners, families, and overall quality of life. Findings drawn from his research offer guidance to clinicians and researchers to advance men's mental health promotion in a number of areas, including suicide prevention. Next, we have Daniel Major. Daniel was born on in Mohkinstsis on Treaty 7, Calgary Territory. He's completing his third year in the Doctor of Medicine program at the University of Alberta and is currently living and learning in Sylvan Lake and Red Deer, Alberta. Daniel is a passionate mental health advocate at local, provincial, and national levels, including serving on the technical committee responsible for the design of the National Standard for Mental Health and Wellbeing of Post-Secondary Students. He continues to be involved in this work as a frequent student speaker for the Mental Health Commission and a member of the University of Alberta's Advisory Committee for implementation of the student standard. We're also joined by Joseph Kevin Israel. Joseph was a graduate student at Ambrose University and a member of the peer health educator team for the 22-23 session. Joseph is currently on staff at Ambrose University as admissions advisor, seminary and church recruitment. He's committed to helping students get by the everyday challenges they go through by supporting their mental health and creating opportunities for important conversations. He pioneered the men and women's breakfast at the Ambrose University Seminary. He is passionate about building healthy communities for students. Our fourth panelist today is Tracy Urquhart. Tracy comes to her position as wellness coordinator at Ambrose University with a background in both nursing and church ministry. She is passionate about mental health from a holistic perspective, encouraging students to engage in healthy practices physically, psychologically, socially, and spiritually. Tracy coordinates the counselors that serve Ambrose students, provides wellness coaching to students, alignment with the mental health strategy, and oversees the peer mental health advocates who provide wellness education and resources on campus. In 2022, Tracy spearheaded the Men's Breakfast for Mental Health to open up conversations around issues related to men's mental health, spinning off an ongoing peer-led monthly initiative for seminary students. And finally, Connor Lafortune. Connor is from Doquis First Nation on Robinson Huron Territory, Treaty Territory of 1850 in northeastern Ontario. He is Anishinaabe, queer, and francophone, and works primarily in life promotion, harm reduction, mental health, and Indigenous education. Connor is a member of the Mental Health Commission of Canada's Youth Council and currently is in his master's in Indigenous Relations. Above all else, Connor is a poet, an activist, a helper, and a compassionate human being. A quick note that Connor will be leaving a bit early, and we're thankful that he's able to join us for the panel discussion. If you have questions for him during the Q&A period, please send them to us, and our team will work with Connor to answer your questions. So I've got a few questions for the panel myself, but I encourage everyone to use the Q&A function in order to make your questions known to the panelists, and we will have time to get to those as we move on. So first of all, panelists, in light of your lived experience and professional experience, why is it important for us to talk about men's mental health? And specifically, why is it important in the post-secondary space? Daniel, can we jump to you first?
Sure, thanks, Ed. And I'm coming to you in a dimly lit call room at the Red Deer Regional Hospital on Treaty 6 territory. And just one story I have about learning on this land was visiting Maskwacis in my first 2 years of my medical degree. And I've been trained thoroughly in Western medicine, but we were invited by an elder to come and participate in a sweat lodge ceremony. And at the end of that experience, there was no doubt in my mind that that is medicine. So thank you for the invitation to be here. And I understand there's a lot of people here involved in student services and providing those services, the registrar to accessibility services. And thank you as a student attending post-secondary in Canada. Thank you for everything that you do for students. It's an important topic for me. My whole launch into mental health advocacy came because of a personal and lived experience in post-secondary. One of the most challenging times in my life. And I just want to tell you and give you the heads up. I'll be mentioning suicide sort of throughout my participation on this panel. It was a time in my life where I was pretty severely depressed, having suicidal ideation pretty much every day. And the decision to finally reach out amidst all the self-stigma that I had accumulated, internalized over years, was made through an appointment through a clinic doctor at the University Health Center under the guise of like a skin appointment or something like that. Like this is the level of stigma that had been entrenched in me. I wouldn't tell a receptionist or anyone about what I need to talk about until the very end of my appointment with this doctor, who I know now had 10 minutes to see me in that appointment, and then I drop on her at the end of it. I'm profusely and profoundly sad every day. But that was huge for me to be able to do that. So I think one thing that's important is this: men reaching out, or masculine leaning people reaching out, is a demonstration of safety and trust in you, no matter what role you're occupying. And I encourage us to be able to recognize that and to honor it. A couple other reasons why this topic is so important to me is during my undergraduate training, my previous degree, I'm a really big believer in healthy educator, healthy classroom, and died by suicide was a professor and mentor of mine, as well as died by suicide as a friend and student leader within our community. So it's everywhere. It affects all of us. And one thing, I don't want to go on too long because I'm eager to hear from the rest of the panel, but there's certainly some intersections that are extremely important that we need to talk about. As a medical student, I haven't been taught about male type depression. This panel is the first time that this is being taught to me, and I am not taught to screen for the features of male type depression in a clinical setting, and that's concerning to me. But also important are intersections, including Indigenous, masculine, gay, and trans masculine people as well. And it's important not just to recognize being at risk, but why? What are some contributing factors like low income, unemployment, colonialism, loss of culture, government subjugation, alcohol misuse, violence, trauma, major depressive episodes, relatives who've been in residential schools, ethnicity, education level. There's so many, and these are the things that we need to also be talking about, not just being at risk of something, but why and how is our society by design creating risk for people.
Great. Thank you so much, Daniel, for sharing that perspective. And I think your experience of the interaction between stigma and reticence to access services is one that far too many of us can relate to really well. So thank you for sharing that. Joseph, your thoughts on why this conversation is so important?
Well, I'm an international student from Nigeria, and Nigeria is a place where you don't show weakness as a man. And I mean, you don't show weakness as a man is you cannot cry, you cannot tell anyone that you're feeling some sort of emotion. You cannot even talk about depression because you're a man. You cannot show any form of weakness. And I have lived through that, where you see people actually die because there was no one to talk to. There was no one to actually open up to. And once you kind of open up to people, you're kind of stigmatized. Before you even leave where you're making such a discussion, you find that half of what you have discussed with those people you trusted in code is already out there. And then you wonder, wait, I don't think I can do this. So it scares a lot of people. They don't want to talk. Nobody feels that it's okay for a man to own up to his weakness. And these discussions, especially, I have seen that. I embodied sexual abuse for 30 years. There was no one to tell that to. There was no one who probably will understand. I started feeling those things affect the way I was living. And I thought, you know what? I'd rather speak up than die in this silence. And to find out that just a few people could appreciate that. And it's a blessing that I got to meet Tracy, who helped me. And through all those kind of drama, I'm able to, be able to think of what to do for men to be able to stand up for themselves. In my professional role here, I've been able to see that some of my friends who are men, they find it difficult to kind of, even in the school setting, which is kind of a closely knitted one, people don't find it easy to want to say, hey, I miss my family. Seeing some of my friends who also came from Nigeria or from other African countries, it's hard for them when they miss their families. I went through that. I thought I was going crazy for 3 months because I couldn't reach my family. My wife was back home in Nigeria. She was pregnant. And I thought, wait, what is happening? Every day I saw that I couldn't grasp what I was taught in class. I thought it was just me being lazy. And that's the same way we think of ourselves because we are men. We're not supposed to think of anything else other than work and making money for our family and things like that. So my eye got opened after I had these few interactions and I saw that there's a lot to be done. A lot of men just believe, nah, it's okay to keep quiet. What other people don't know will not really affect you. Unfortunately, what you keep inside sometimes kills you. So I'm excited about this opportunity to hear people talk about it and see the fact that we're even talking about men's mental health is a big deal for me. I'm so glad to be a part of this.
Well, thank you so much, Joseph, for being a part of it, and thank you for sharing your experience with us. Can I turn it over to Connor?
Of course, Chimigwech Kanawaya Ani Bonjour. I am so grateful to be a part of this conversation. I think it's so important to be having, especially as a young person in post-secondary as well. I think it's something that we don't talk about often enough. I spend a lot of time around Indigenous people, around Indigenous men specifically, and I think that for me, it's a time to heal a lot of that intergenerational trauma that has been passed down. A lot of the times when we talk about Indigenous peoples, and resurgence, we're talking about Indigenous women. So we have women's circles, we have women's, regalia making sessions, and all of those things come with healing and those voices that are able to be uplifted, and a lot of that language piece that comes through in those spaces. But we often don't have men's spaces, and a lot of the time it's our own fault for not gathering, but it's also something that has been passed down throughout the generations to not have time for men to speak together and to heal a lot of the traumas that we're not only receiving from colonization and from a Western paradigm, but also implementing within our own communities. And so being violent towards our families, expressing things that maybe aren't true to our culture and the way that we used to be because of just the effects of colonization. I'd like to share just a small anecdote. I was at a men's group, Indigenous men's group, for an entire week, and we were just talking about uplifting and all of these wonderful things, and we were doing exercises, and we did poetry, and it was really, really beautiful to do this with like a range of Indigenous men. And I was quite young in the group. Everyone was 40 to 80, I would say, and it's really beautiful to see. And at the end, we had a sharing circle with 150 men, and we went around, and we only passed the feather on once because it took so long. I think it was like 3.5 hours. And at the end, one of the customs that we have is you give a hug and you get a hug, or you shake someone's hand and then they shake your hand. And so everyone gets to do that twice, essentially. And it started with shaking hands. And then at one point, it just transformed into these like big bear hugs, like these most amazing, like hugs that like people did not want to let go. And we did that twice around. And I think just the hugging took about 20 minutes because people did not want to let go to those feelings. And people were crying and being emotional and being so vulnerable. And it was the most beautiful thing I'd ever seen, because it's something that you often don't experience, especially in Indigenous men's groups. So the importance of talking about those things is not feeling so alone. When you have those sharing circles, when you have that time to express yourself and express your story, other people relate to it, and you feel really validated in your experiences. And so you have folks that are talking about like, I experienced this trauma, and then when it gets around to their time, it's like, hey, I experienced that trauma too. And there was this beautiful circle that went around when we talked about sobriety. I myself am approximately 3.5 years sober, and when we went around, every time that someone talked about their sobriety or whatever, whether it was 1 day or 40 years or 3 months, everybody clapped and cheered and said, congratulations, we are so proud of you. And just to have that, especially in a men's group, in an Indigenous men's group, it was so validating and so beautiful. And it gives us the chance to become something greater, and to really promote that in our families, in our lives, in our workspaces. When we are healthy, we promote health, we promote healing, and we promote balance in all of those aspects. So I think I answered the question, but Chimigwech for the time.
Yeah, thank you so much. What a great story, Connor. Thanks for sharing that with us, and it's great to see you again. John, you bring a bit more of a research perspective to this question of why it's so important for us to talk about men's mental health.
Just a shout out to Daniel, Connor and Joseph, that just really rich examples of the talk that we want to normalize, the ability to tell our stories and be able to connect, and socially connect in and around those. So part of the thing that we often get asked is about how to facilitate those conversations, because sometimes we don't expect guys to talk, and that's part of the breakdown. And so, just borrowed from Movember and Alec, the idea of ask, listen, ask to elaborate, and then check back in after a conversation as really key kind of things to facilitate that. Because I think when we expect guys to talk and share, they do. They just need the affirmation and permission. And that's often one-on-one situations or in a group. And we see time and again, community-based work in mental health with guys can work so well if we can just create the environment, but also just connecting with friends who can go a little deeper in terms of the conversation can be massively important. I think that idea of trying to get upstream and not be caught in the crisis for the conversation, you know, that regular kind of health promoting kind of aspect of connecting with people and being able to have the conversation about what's going on. And then my final thing would just be to say the vulnerability piece is so interesting to me. The Hollywood ending of the vulnerability often ends in people talking about resilience. But I think vulnerability is a state that we want to engage with as being okay, you know, as being able to talk about those challenges in real time and not in the aftermath of I've cured everything and fixed everything. And I think the 3 testimonials, you know, that were shared just now are lovely examples of that. Like, it's ongoing, and we work with those vulnerabilities, you know, and we share those to work through.
Very good. Thank you so much, John. And Tracy, over to you. You're really embedded in this post-secondary space. Why is this an important conversation in your space?
Well, first of all, I just want to say thank you for including me. I feel so humbled listening to your guys' stories, and just so privileged and blessed to be a part of this conversation. I think it's important to talk about men's mental health in post-secondary spaces for 2 reasons. The first is obviously the statistics bear this out. This is a demographic that is at risk for suicide, for actions related to suicide and self-harm. And so it's imperative that the post-secondary spaces acknowledge this and provide not just resources, but places where men can begin to talk about these things and have those spaces to give voice to what they're going through. And actually, that helps develop the supports that are actually relevant for them in that situation. Secondly, I think that men on our campuses really actually do want to talk about it. They see the need, they're looking for support, but they might not have the words or have had the opportunity to talk about mental health in a supportive way. So to illustrate that, I just want to share just a short story. So we had last year had an initiative where we were doing an event to gather men together to talk about mental health issues among men. And I was promoting this event. So I'd done little table toppers to put on the cafeteria tables to invite men to register. And it was sort of early in the morning, so there wasn't a lot of people out in the cafeteria, but I was putting them on the tables, and I came across a table of 2 of our student athletes, a male athlete and a female athlete. And I just said, oh, excuse me, like, can I just put this on your table? And the male athlete picked it up immediately and said, oh, what is this? And I said, well, you're invited to breakfast. And he was like, me? I'm invited to breakfast? And I'm like, yes, we're having a whole breakfast for you specifically, so you can come and talk about your mental health. And we kind of laughed about it. And he said, no, seriously, like, what is this? And I said, well, you know, we are inviting all the men on campus, undergraduate, graduate, to come to a space, enjoy some food, enjoy some friendship, and start to talk about mental health initiatives. And as I was saying that, he reached across the table with his long arm, and he slapped his friend on the shoulder, and he said to her, see, I told you men need to talk about their mental health. And as I walked away, I was just so impacted by the fact that actually guys are talking about it. They may not be given the space to talk about it by other people, but it's there. And so to create those spaces, to create opportunity, I think is going to be really important at providing the resources and addressing the needs that men have.
Thanks, Tracy. Another great story, and really, really kind of emphasizes and reiterates some of John's points about the importance of opening the door to those safe spaces and starting those conversations. So that's wonderful. Thank you all. I'd like to loop back to something that you had talked about, Joseph. You talked about being an international student and how loneliness played a big part in your experience. And I think that, you know, for many students, even if not international, they're away from their typical support systems, and isolation, loneliness plays a role in their experience. And we know that social isolation, loneliness, depression are among some of the strongest risk factors for suicide amongst men, alongside, you know, use of alcohol and binge drinking. But I'd like to talk more about the importance of relationships and belonging when supporting men's mental health in non-clinical formats as a protective factor. So through support, peer support, and other formats. Would you like to start us off with your thoughts on that, Joseph?
Okay, one of my friends, I'm just going to start this and then I'm going to loop it up with the men's and women breakfast thing that we did at Ambrose. One of my friends here is still a student here at Ambrose. He had his family back home and he was living in the far northwest. So it was isolated. He was living alone, so the only thing he did was come to school, take classes, and then go back. And I realized that he was losing weight. He was eating good food, but he was losing weight. And he was finding it difficult to express himself when I asked him questions. And usually between men, and at least that I know in Nigeria, between men, we like to kind of make jokes and things like that, but it was just not responsive. And then I remember the thing of how I got affected and I had to ask for help. I am a very atypical man. I speak out a lot because of my experience, but I know that our usual men don't do that. So I spoke to him. What is going on? He didn't say anything until I forced him to say something. He said he's missing his wife and he has not seen his kid that was born. She was about 2 months then, and he hasn't seen her. And I could understand, but I told him to reach out to a counselor, but he said, oh, no, you don't do that. And I'm like, oh, you don't do that? Okay. So I kind of took the initiative of asking Tracy then, because we had this discussion, to help me send an email to him to just ask him to come for a discussion. And I can tell you that really helped him. And so looping back to what she said about the men's mental health event that we had, I was blown away by the response and the attendance of the guys. And I saw guys sharing a round circle on the table. I saw guys opening up. I couldn't believe what I was seeing. But the downside for me was there were only like 2 or 3 of us that were graduate students. And I felt maybe we were too busy, or maybe it wasn't a good time. And then we just started thinking about how do we create a social circle for these men and women where they can talk. And it was easy for us to get the men because we included it was men and women's breakfast. So it wasn't looking like we targeted them. So, why would they want men to just come and have breakfast and talk? So it was very intuitive for us to just say the men and the women's breakfast. I knew it wasn't a very big problem for women to just chat about things they're going through, but I knew it was really hard for men to do that. So we had the first one, and I saw a lot of guys come in, and then they were talking. We just went on about the different things that were deep. Normally you wouldn't talk about to strangers. And I looked around the room. No one was really close to each other before then. And one of us just was close to tears, telling us that he was going for surgery. That was on the second meeting. He was going for surgery and he'll be away for a long time. And he just thought he's not been able to share that with anyone. And he felt it was going to be, this is a safe space. And he hopes that we can pray for him and stuff like that. And we did. And we reach out constantly to know if he's okay. And I believe that if we create spaces like that, a lot of time we assume that men don't want to talk. We want to talk. And we just need that a space to express ourselves. And I bet you, if you find a group of men actually chit-chatting, you understand that we really love to talk. We just need an enabling environment for that to happen. And I think that will reduce the rate of, say, depression, suicide, and stuff like that if that door is open to us.
That's another awesome story, Joseph. Thank you for that. Connor, I know you need to sign off. Did you want to weigh in before you click goodbye?
I'd love to. I think following that up, though, it's such a wonderful story. I will go quickly. I'm sorry I have to hop off, and I'm looking forward to watching the recording afterwards. But for myself, I think when I think of belonging and men, I think of sports and I think of clubs. I grew up in a very small town where like one season was hockey season and the other was baseball season, and like that's where we gathered. That's what we did for fun. That's the spaces that we talked and healed and laughed at each other and grew. And so I think what's difficult is moving from, that environment where we're all together. We're always, 5 times a week we would be on the ice and we're talking the whole time. It's like, hey, this is going on in my life. And this is like, we find that sense of belonging in those clubs, in those sports. So when we move to a different city, when we attend post-secondary, we lose a lot of that. You age out from hockey and baseball and things like that when you're about 18. And so going from, always doing that 5 times a week to absolutely nothing can be very difficult. And a lot of the time we lose those connections, and, we're spread out across the province or the country or the world, really. And so for myself, when I think of belonging, I think of we need to ignite those spaces in post-secondary times, and not only just gathered around alcohol. Often the spaces where we gather or where we can find belonging is through alcohol and consumption and partying. And there's other ways that we can do that through the school that is not necessarily like these big sports clubs, but little things that we can do to implement belonging would be to have those spaces that are just open to make friends, to talk, and that healing and those talking, that sharing will come naturally, because like it was said, like we'll talk, we would love to talk. We just need to find people who make us feel like we belong in those spaces, like we feel at home. And for Indigenous people, often it's like drumming circles or beating circles, or anytime there's food. I think that belonging in post-secondary spaces has to come with food. So I will leave it there. Thank you so much. Minugashgad Kinawaya. Have a wonderful day.
Thank you so much for your time, Connor. And again, if anyone has questions for Connor, please feel free to put them in the Q&A, and we'll make sure that they're passed on and can get some responses. John, your thoughts on the importance of relationships and perhaps peer support in supporting men's mental health?
Yeah, I just echo the comments that have been made, and the stories are really powerful. They illustrate a couple of things that we try to reproduce in programs that we put on campus and in community more broadly. A couple of things that we always are trying to do is wrap it up in an activity. Guys tend to do well when they're doing something. So if you invite guys in the space just to talk, there's a bit of pressure on needing to say something. Whereas if it is a breakfast and it's something to eat and it's a connection over a fundraiser or just something to bring guys together, we find that works really well. And the other piece, our work suggests that guys are really good shoulder to shoulder. So tend not so much, like direct face-to-face and that pressure that there might be a right answer to something, but more in the doing and the shoulder-to-shoulder piece. So we often see that in terms of environment. So just to lift a couple of principles that we try to reproduce from the stories that have been shared, that's the kind of thing we try to reproduce, because when you do age out of hockey, and when you do, your mates get married and kind of have a family and move away and things like that, it gets a little bit tougher to have those connections that you might have had firmly in your earlier years. So again, it's trying to recreate some sense of community, belonging, and reducing that burdensomeness that we might have in feeling like they don't have time to connect with me, and that sort of stuff. Just trying to create something a little bit more social for guys.
Thank you so much, John. Tracy, I want to change directions a little bit, if I could. And, just recognizing that rates of depression and suicide are higher among men, but that there are also other interesting intersecting factors that are impacting men's mental health and their health-seeking behavior. Cultural views of mental health, masculine norms, being a member of a minority group, all have kind of intersecting and compounding influences. So knowing how important this is, how can supports and services be tailored towards specific subgroups of men, whether it be Indigenous men, international students, members of the LGBTQ2+ community? How can supports and services be tailored to those specific subgroups, Tracy?
Thank you. Thanks for the question. yeah, we're such a small university. It's interesting because this question is actually in the forefront of my mind all the time. And the reason is because our international student population is growing. And so Joseph has shared, some great stories about his experience as an international student. But this is like our graduate program is almost all international students. Hey, Joseph, like it's a large majority of them. And so we do see this kind of the subgroup growing. And wondering how myself as a white Canadian woman can provide supports and stuff that's accessible for our students who clearly come from a different experience, with different ideas of what mental health is, different family experiences, and different masculine norms than what we would have necessarily on our small Ambrose campus. One thing I am really grateful for is working with students. And so students like Joseph who have those connections and are making connections that I don't necessarily have. So on our peer health team, one of the things that I've made sure over the last couple of years is that we have had students who, number one, were male, because often mental health is seen as very feminized. And so having a male student, thank you, Joseph, for coming on when I called you up. And also students that are international or have different diversity backgrounds. So that's really important. For me, one of the things that I want to do is position myself as a learner. And so I would really encourage like anyone who's listening, who's a part of the programming side of developing stuff on campus, is really positioning yourself as a learner, relying on the experience and the expertise of others. I don't have everything I need to make things happen, but I do have access to people around me. And when I rely on them and learn from them, I actually get better at what I do and have those connections with students. So one thing this year that we've done is I've started meeting with our international students. They get together for lunch. And so having those opportunities to speak to them just around what mental health is, why we talk about it so much in Canada, take your vitamin D, those kinds of things. But then also just challenging the notion. So this is specific to our culture at Ambrose because we are a faith community. Challenging the notion that accessing mental health supports is contrary to faith. And that's been a big thing about our niche and the differences that we have on campus is often people coming from the Christian faith feel like accessing mental health is contrary to their faith. So really encouraging, good wellness attitudes, and that wellness includes physical health, psychological, mental health, social health, and spiritual health, that they all together make ourselves thrive as human beings and our communities thrive. So just really combating that. And then I'm just going to give a little shout out to, we do have a small LGBTQ population on campus, and it is quite small because of the demographics that we draw from. But when we did the men's breakfast, I clearly reached out to them and specifically opened up the door and talked to them ahead of time about what kind of messaging we were going to use, about how welcoming we wanted it to be, and including them. And it actually really opened a door for me to have conversation with the group that had identified themselves as that, so that I can continue to have those conversations in the future. We really do want to be a supportive campus. So yeah, hopefully that answers the question.
Very good. Thank you for that. I really appreciate your advice about, surrounding ourselves with people with diverse experiences and then leveraging and learning from their knowledge as we move forward. That's wonderful advice. Thank you. Daniel, your thoughts on how to best support subgroups of individuals?
Yeah, thanks, Ed. And I'm just kind of enamored by the panelists and the conversation. So coming back to what I was thinking about with this question is something I've read from Brené Brown, her book Daring Greatly, and the concept of masculinity, which was unveiled in the development of the Conformity to Masculine Norms Inventory. This is created back in, I think, 2003. And so the attributes of traditional masculine norms are winning, emotional control, risk-taking, violence, dominance, playboy, self-reliance, primacy of work, power over women, disdain for homosexuality, and pursuit of status. And as I read that list, I think of a breeding ground for poor mental health. I can't imagine, reassuredly, I looked to the literature after that, and conformity to these masculine norms is inversely related to help seeking and positively correlated with concerning health variables and substance use, which we know is also part of kind of male type depression. So I think with masculine leaning people having that high index of suspicion when you're encountering them in a post-secondary setting of reaching out and asking for help is important. And also, learning from Connor and his experience in the sharing circle, and Joseph, your experience with some of the peer support work and hosting the breakfast. And also the experiences of queer people and their intersections with masculinity. Sharing this idea that visibility is important. Masculinity has a lot to learn from the experiences of people who've talked today about visibility is important. Permission is essential. Giving permission in these services, from these services, to share and be present is essential. And I think that we can take a strengths-based approach and say, what are men already doing in their communities, and say, how can we support that and build activity around it and building community. One example is Sylvan Lake, for those of you who don't know, is a little town in the middle of Alberta that has a big lake, and it's a tourist destination in the winter. It's a huge ice fishing place, and I can tell you, I don't think there's any fish in the lake. I'm pretty sure there's no fish. But I think it is a way for men to come together and be able to talk to each other. As far as I know, that's the entire reason that ice fishing exists. I don't know this, but that's an idea, and maybe that's true. I think about, asking the question to yourself, is that what, in providing the services that you offer, is that what they're really here for? Making that recognition and asking yourself, being curious and having gratitude for when men do reach out. And I'm reminded always of the story that I learned that Kevin Hines, who's a survivor of a suicide attempt off the Golden Gate Bridge in San Francisco. And he talked about something that he did in his sort of state of psychosis and having bipolar disorder, was going to the registrar and dropping out of all of his classes at once, without any indication, without any warning. And I thought about that, and it stayed with me as this critical sign and a critical moment of intervention that the post-secondary institution could have had, some kind of early alert referral system that triggered a red flag. And I think that the national standard for post-secondary students helps to inspire and inform post-secondary institutions on what things we can do in a flexible way within the culture of the organization to create a culture of well-being, take that whole campus approach to well-being in the learning environment. And I think that's what the standard can be used for.
Thanks for those comments, Daniel. I grew up in Alberta, so I spent much time on Sylvan Lake, and I can't remember a fish ever coming out of that lake. So you might be very right there. We're getting a bit short on time, but I would like to turn it over to Joseph for some brief comments on how you see services and supports can be tailored to meeting the needs of specific subgroups of men.
Like I mentioned initially, one of the easiest way, so I coach soccer, and we realized that one of the ways to get the boys to come is to make the girls tag along. I don't know. So, Daniel mentioned something about just using the fishing time to have a community to talk to. And I think like we do here, sometimes you have these meetings and you have just 3 people, 2 people, 5 people, 10, but we don't stop. Now, creating that space is intentionally saying whether you're here or not, this space is open. So until you discover that you need that space, it still will remain open for you. We sometimes quickly give up on the idea that men are not wired to, just want to get out of their comfort zone. So when we start something, we shut it down because we feel, well, I don't think they are going to be wired that much for that. So the idea is, like Connor said before he left, food is actually very important. I've seen that over and over again. Once you include food, I don't know if it's a men thing or maybe women to like food, but I know that I've seen once you invite men to something and you include food, we're always a lot. And then it's a time of sharing and, speaking up these things. So I think including food as a strategy is one. And sometimes not just sidelining it to be, oh, it's a men's event, even when it's there's a part of it probably targeted towards men. Make it, we're not lying or we're not trying to deceive them, but it's such that they don't feel like, oh, I have a target on my back. I realize that men don't like that. I'm young. I may be wrong. Maybe the older generation prefer, but I know my generation don't like having targets on their back. So they want to just if it's something that is solely dedicated to men and then it's a reoccurring thing, they quietly withdraw away from it. But if it's something that has a collusion with other people, then they are there. And so no one is looking over his shoulder until they get comfortable and then they draw other people in. So I think that would be a good strategy to use. Just be consistent with pushing those things out. And with time, when they see that this is a safe space, they want to invite other people to be a part of it.
Thanks so much, Joseph. I'm going to give John the last word on this topic and then move on. I have so many questions myself, but I can't be too selfish. I have to give the audience a chance. So we'll move on to some questions arising from the audience. If you've not done so yet, feel free to add your question into the Q&A feature. And my colleague, Katie, is monitoring the questions and will forward those to me. So we can get to those audience questions in just a moment. But John, the final word on how to tailor supports and services toward the needs of specific subgroups of men.
Yeah, so perhaps an example from UBC is that we're a veteran-friendly campus, and about 2/3 of our veterans who are coming back from active service and coming into university are male, a third are female, and we've worked really hard here to work with their context. They show up differently than people who are straight from school or a bit younger and haven't had that military experience. So we're trying to, integrate them into the wider UBC community with some housing support, with also some guidance around classes and, because they're oftentimes used to structure, and trying to build in some different strategies for them to adapt and also keep that collegiality that is often around military. So, it's just an example of a subgroup that we might want to think about differently within the context of university life. And just, building on a couple of points around the masculinities piece, there is a movement towards inclusive masculinities, and it comes from McCormack and Anderson, and it kind of builds on this idea of a contemporary masculinity. And I totally agree with the piece around the shackles and the straitjackets of traditional masculinity for a lot of guys. And so there is a bit of a movement that's talking about a generation of young men having different values and virtues. that is strength-based. And I just think it's a really important conversation to nurture and to build upon, because I think it's something that is growing. And I think within communities that are universities, I think a lot of what's been said today would help us think about building that as well, that healthy masculinities piece. So again, just a shout out to those that idea of working with discrete groups, but also that idea of getting it together a little bit more in terms of this inclusiveness and these things that we value in terms of diversity, equity, and inclusion.
Very good. Thank you for that, John. And thank you to all of the panelists for entertaining my questions. We'll open things up now, and I do see a few questions in the Q&A already, so thank you for that. Feel free to keep adding more. We do have just a short time, so we may only get to 1 or 2 questions live, but do have a record of all the questions coming up so we can attempt to get information back to you. I love that a lot of the discussion has been around loneliness and ways of bringing men together, whether that be at breakfast or ice fishing or going for a walk or other kind of shoulder-to-shoulder activities. So I love that we're talking about relationships and connection, and because there's such significant research indicating that the quality and frequency of social connections are integral to our overall wellness and well-being, both physically and mentally. But I think sadly we're seeing, as Joseph was describing, more and more feelings of isolation and loneliness on campus. So in the case that, with social inclusion being such a significant part of well-being, do you think that post-secondary spaces as they are now are inclusive towards men? And what can be done to improve that? Can I point that question to you, Tracy, to begin?
Thank you, Ed. Are they inclusive towards men? That's a good question. Our campus actually is a majority of women. I think it's almost 2 to 1. So 2 guys for every 1 gal. There's lots of competition for relationships. A lot of guys that I've heard kind of feel like they're targeted, like the girls are all competing for them. I don't know. I don't know, Joseph, you might be able to speak more to it, but I'm not sure they are. We do have our residence floors are divided, so they're not co-ed. So there is some camaraderie that happens among the students that live in res, but again, that's a minority group of students. The majority of students actually live off campus. So I think we do have a challenge with engaging students and creating spaces where they do feel included.
Great, Joseph, can you weigh in on that?
I think some of the activities done in school help that. For example, the sport teams, the guys go to the gym together. They play volleyball, they play basketball. And my fear is for the guys that are not athletes that are not on the team. How do they find their space? And one of the things I kind of started outside the school, I think I mentioned it to Tracy one time, is I used to do it. Now I'm so busy now. I used to do like once in a month, lunch or dinner, just send out, especially for the African group, because it usually feels a lot isolated. So I send out that, and then they come to my home. We just have lunch or dinner, or we go to maybe a park or something, and we do that just to create that camaraderie and to, so you don't feel left out. And I think especially with our small space university here, one of the things I think schools can do is create those small pockets of, we have this group for maybe find an activity, games, if you want to drop in and things like that. That can foster that relationship and create some connections between men. I think activities will bring men together.
Thank you, Joseph. A number of the participants are asking for additional ideas as to venues or vehicles that can be used to bring men together. We've talked about breakfast. We've talked about some shoulder-to-shoulder activities. I wonder, John, through your research or your experience, if you could share some other mechanisms that you've seen successful, be it men's sheds or other kind of vehicles for bringing men together in a peer support kind of way.
Yeah, interesting. Thanks, Ed. So, drawing on a couple of examples that could actually translate to campus life. The men's sheds has done well in Australia because there was government money for it. It's seeded well here in Canada as well. We've got a number of sheds, and these are places where guys gather on a volunteer basis. There's no pressure to be there at a certain time. They work on projects together. It's activity based. It drives a sense of purpose and gives a little bit of routine. And oftentimes guys are looking for that. One of the things we grapple with is around time, because often we're trying to convince guys that this would be time well spent. And because these things are often free that we try to build and bring guys into. So again, little incentivizing pieces. The Dudes Club, which deals with often mostly Indigenous men who are experiencing challenges around poverty and around homelessness. It works really well because they bring these guys into a group, have a haircut and a feed, bring them into that space, and the conversations unwrap. So about health and about how people are tracking, and lots of good interaction and social connection. So again, I think we should think about those principles when we're trying to build something within particular communities and in universities to give a sense of belonging, but also a little bit of a purpose, a kicker, as in something that would justify the time you spend. Because I acknowledge that so many of our students are so busy. They're trying to run part-time jobs and tuition and get good grades and work through. So there's a lot of pressure on time. So it has to value add, and we've got to feel it pretty much early on to keep them in the game, so to speak. With different programs. So a couple of ideas there.
Great, thanks for those ideas, John, and a huge thank you to all of the panel members for your generosity with both your time and your knowledge, helping to enlighten us and share with us today. That's all the time that we have for questions. I've really appreciated the opportunity to participate and be part of this conversation today. So thank you, and I'll turn things back over to Amy.
A big thank you, Ed. Just want to remind everyone that in talking about today's topics, and today's webinar touched on difficult topics, and stories were shared around mental illness, mental health problems, and suicide. So just a last reminder, if you are in need of support after today's webinar, we want to ensure that you have supports available to you that can meet your needs. So to make this easier, just one last time, we'll list in the chat the resources that you see on your screen that you can access at any time if you feel the need. So please take a copy of those and take them on your way as you leave us today. But I want to say a very big thank you to our wonderful speakers for sharing their time and expertise with us today, and to Ed for facilitating a very enlightening discussion. We have no doubt that this webinar left the audience feeling inspired to prioritize creating spaces for men to share and connect. I know that's how I'm leaving today feeling. And in general, it's our hope that this webinar will contribute to our collective efforts to offer comprehensive approaches to men's mental health in post-secondary. If you'd like to know more about our work related to the standard for mental health for post-secondary students, we invite you to check out the resources we have highlighted on the screen. We'll also share this information in the chat. But finally, a last thank you to our audience as well for joining us today and taking the time to be with us around this important conversation. Merci, et on vous souhaite une belle fin de journée.
Thank you very much and wish you an excellent end of day.